So, moving on from tisotumab, we will look at our second antibody drug conjugate. So, trastuzumab deruxtecan is again an antibody drug conjugate. The antibody is trastuzumab. This is an anti-HER2 therapy. It's a drug that we have used in breast cancer for many, 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 many years. And we've now used it in not just breast cancer, but other populations that express HER2. We've given it in a lot of combination therapies. It's been around for a very long time. The payload, the deruxtecan, is a topoisomerase inhibitor, which is another one of our old cytotoxic drugs that hits fast-growing cells. And then keeping them all together as long as we need, and then dropping it off in the tumor, we have the tetrapeptide-based cleavable linker. So these three together make up trastuzumab deruxtecan. The drug currently has several different FDA approvals. I'm not going to go through all this since we're focusing on cervical cancer, but the drug is approved for several different populations in breast cancer, and those are continuing to grow, including patients who have very high HER2 expression, to those who may have just a tiny bit or a HER2 low type of expression. The drug is approved in the metastatic setting and certain neoadjuvant and adjuvant settings for breast cancer. The drug is approved for patients with advanced lung cancer who have activating HER2 mutations. So not looking at expression, we don't see that as commonly in lung cancer, but the HER2 protein and signaling pathway can be activated by certain mutations that turn on that pathway that we can see in lung cancer, and the drug has been shown to work well there. And then gastric or gastroesophageal junction cancers that have some expression of HER2. And then in April of 2024, trastuzumab deruxtecan got an accelerated approval in a tumor agnostic setting. So what that means, and I'm going to show you the trial, is that the drug got approved for advanced solid tumors. So not just a specific tumor type, but benefit was seen across a variety of solid tumors. And so the official FDA approval is for adult patients with unresectable or metastatic solid tumors that are expressing HER2. We use something called immunohistochemistry to look at the expression of the protein in the cancer cells. And based on how much the protein is expressed, a score is given. So 3+ is going to be the highest level of expression, then 2+, 1+, and then 0 is negative. So 2+ is kind of moderate expression, and then 3+ is high. So it is approved for the patients who have the highest HER2 expression in the cells in solid tumors who have received prior systemic therapy and have no other satisfactory alternative treatment options, or this is a more preferred treatment option. So let's look at the trial that got this approval. It's called the Destiny Pan-Tumor02 trial. And what I do with my job every day is looking at a variety of different solid tumors and then looking at the genetics of why did a healthy cell become a cancer cell? How do we match treatment based on it? And HER2 expression can be seen across a variety of different solid tumors. And so this is a clinical trial that I actually have printed out near my desk for reference fairly often. So it was a really important study for getting trastuzumab deruxtecan approved in this histology agnostic setting. And it's because it was a single arm, open label phase 2 trial that looked at 267 patients across 7 tumor types who had either the highest HER2 expression, so the IHC 3+, or the moderate expression, the IHC 2+. And so this is an IV drug. I have the dosing there. There are some different dosings of the drug, but this was the 5.4 milligrams per kilogram IV once every 3 weeks. The primary endpoint was overall response rate. And so I have the bar graph down here. You can see the confirmed overall response rate on the y-axis. And then you can see some of the different cancer types that were enrolled. So endometrial cancer, cervical cancer, ovarian cancer, bladder cancer. There was kind of an other group, biliary tract, and then pancreatic. So patients with all of these different cancers were enrolled based on the cancer that they had. We'll focus on the patients with cervical cancer. And you can see the confirmed response rate in patients who had the highest expression of HER2, so the IHC3+, was 75%. However, the patients who had an IHC2+ was 40%. And so, since we saw benefit in both of these groups, the drug became a treatment option for both. And so just to give you a look at the median progression-free survival, the highest expression is in blue, the intermediate is in the green, and for both the median progression-free survival and the median overall survival, you can see that, again, the highest benefit was in the patients who had the highest HER2 expression, but there was still benefit in the patients who had the IHC2+. So again, because of that, trastuzumab deruxtecan is an additional treatment option for patients with recurrent or metastatic cervical cancer with HER2 IHC3+ or 2+ disease. And so let's come back to our take-home points. Hopefully, these all make a little bit more sense now. So we first reviewed the Keynote 826 trial that established a role for the immune checkpoint inhibitor pembrolizumab in combination with that standard backbone of chemotherapy with or without bevacizumab in patients with newly diagnosed advanced cervical cancer. So this is a treatment option, again, for our newly diagnosed patients. Based on the benefits we were seeing in the advanced population. However, there is now the Keynote 18 trial that has supported moving immunotherapy, pembrolizumab specifically, into the first-line setting for locally advanced cervical cancer. Because immunotherapy is being given so much in potentially the locally advanced setting or in the first-line metastatic setting, we do need additional treatment options in the later line settings. And this is where our antibody drug conjugates are additional treatment options in this setting. And so tisotumab vedotin that targets tissue factor and trastuzumab deruxtecan that targets HER2 are both emerging or are both currently treatment options. And then we have numerous emerging antibody drug conjugates as well, given that we know that there is a need for additional treatment options here and that both of them are it looks like there are certainly benefits to using these targeted therapies over the traditional old chemotherapy. So with that, I would like to thank you so much for your attention. I hope that this has been a helpful learning experience, and I wish you all the very, very best.